actor, actress, and director, Debbie Allen is now taking on a new role. Perhaps best known for starring in the movie and TV series Fame, and most recently for her producing, directing, and acting on TV, Debbie's now stepping out to help people who have an abnormal heartbeat requiring a pacemaker take charge of their health.
Debbie Allen joins us now, along with Dr. Lee Friedman, a radiologist who also has a pacemaker, to tell us more about a new campaign. Debbie, Dr. Friedman, thank you both for joining us here today on the Urban Housecall.
Oh, we're happy to be there. And I just quickly want to give a shout out to my brother Hugh Allen and my mom Vivian Ayers in Chester, South Carolina, because you all are right down the road from them.
Oh, that's
Absolutely.
wonderful. Now, Debbie, you've been so busy with acting and directing lately. Tell us about some of your most recent projects. What have you been working on?
Well, I was a judge on So You Think You Could Dance earlier this year. I have been directing Grey's Anatomy for the last 3 years, actually.
Really?
Yeah, that show is so incredible, and I was, just thrilled when I came back from vacation. They said, Debbie, we want you to come in early because we want you to play Dr. Avery. So I played this breakout character who is the mother of one of the favorite characters on the show, Jessie, and a urologist who did the first penile transplant. That was a lot of fun, a real challenge. And I've been working with Mariah Carey, and I'm getting ready to do the Hot Chocolate Nutcracker December 8th at Royce Hall with Raven Simone, and it's a wonderful production. So I'm kind of keeping that pace going, if you know what I mean. I am kind of a pacemaker, and so this campaign really fits into my lifestyle. And
well, Debbie, you are so talented and gifted at what you do, and we are certainly looking forward to all of your upcoming projects. And I know you've always been committed to educating our youth in the area of the arts, and you've been such an inspiration as you continue to share your gifts and your talents with the world.
Yes, thank you so much. It's a real part of my heartbeat is young people, and so it's a privilege to be able to use celebrity to do these things. This campaign, jointhepacemakers.com, is so important to me personally because heart disease has run in my family. I lost my dad, my aunt, my uncle, many family members, and my best friend, Armando Zatina, recently had to get a pacemaker. And pacemakers historically are not compatible with MRI technology. And
That's
MRI,
right.
yeah, MRI, as you know, is one of the best diagnostic tools in medical, profession, capturing images of the brain, the heart, and soft tissues. But now there's a new pacemaker that allows you to have an MRI. And this is brand new technology, and I just want to make sure everybody knows about it because an informed patient is the best patient, and that people know that they have options. That is the best news right now.
Absolutely. And that brings up a good point. Debbie, do you mind if I call you Debbie?
No, please call me Debbie.
Okay. Well, that certainly brings up a good point. What options are there for those individuals who have a pacemaker currently who have not been afforded the luxury of getting an MRI when it may have otherwise been indicated, particularly as it relates to your campaign with the pacemakers and the specific pacemaker that it is that you all are endorsing? Do individuals who have pacemakers at this time have options?
Well, this is a very difficult question, and it's a question that has made us get on this horn and toot it loudly. Once you have a pacemaker, my understanding is it's the wiring, is it not, Dr. Friedman, that starts to really become part of your own heart. So it's very difficult to undo that wiring and to change it out for another pacemaker. It's the wiring. But if they do need an MRI, it is very involved and it's very dangerous. So their health could be compromised, or they may not get the tests as quickly or as clearly as they need. They may have to have a surgical procedure to determine the degree of difficulty they are having with a particular medical issue they're having in their body. Dr. Friedman, what do you add to that?
No, I mean, I would agree. I mean, the traditional pacemakers are very unsafe in an MRI environment. I mean, the government's been very clear about that. as a radiologist, the American Academy, College of Radiology, I mean, all sorts of professional organizations have said if you have a traditional pacemaker, unless the benefits far outweigh the risk, you should not do it, not go into an MRI environment. Because you know, like Ms. Allen was saying, the leads could heat up and burn the heart. The pacemaker could turn off. I mean, all sorts of bad things can happen. And I'm a patient as well. And you know, as a radiologist, I saw all these patients who had diseases that would come in and they couldn't get an MRI because they had a traditional pacemaker, and their disease was delayed in diagnosis or treatment, and that affected their outcomes. And when I was told I needed a pacemaker, I was extremely hesitant to get one. I was actually told my wife I'm not getting one, and I eventually asked the right questions and said, hey, when are you going to get a pacemaker that can be used in an MRI? And I was fortunate enough that 3 weeks before that, this pacemaker had been released, and you know, I was like, that's the one I want. Sign me up. I'll take it. And you know, I have that pacemaker. I can go into an MRI environment to treat my patients. If I need an MRI down the road, I'm a 38-year-old gentleman right now. I'm active, so maybe I need it for ligament injuries and orthopedic injuries now. But down the road, if I have a stroke or something else, I want to be able to use it.
And you have 4 children.
Let's not forget that.
That's right.
Let's
That's
not
right.
forget that.
That's right. Well, you know, you all really raise an interesting point here, and that is our mission here at Urban House Call, to educate the community that there are choices and that there are options. And we really want to empower our listeners here to ask the questions. If there are, you know, if there is a certain need that they have for a medical procedure or a medical device, ask the right questions and make sure that they have all of the information to make the best choices.
That's the way you
Absolutely.
go. So log on to jointhepacemakers.com and find out all about this new campaign.
Debbie Allen, award-winning dancer, actress, producer, director, and true champion for the youth in the arts, and Dr. Lee Friedman, radiologist and pacemaker patient. Thank you both so much for joining us today on the Urban House Call.
Yes, indeed.
Thank
Happy-
you for having us.
This is Join the Pacemakers program. Log on to www.jointhepacemakers.com for more information.
Thank you
Thank
so
you.
much, guys.
Thank you again for joining us, and we really look forward to all the great information that you all are putting out there, and we definitely will endorse it with our listening and viewing community to ensure that people do, in fact, have the information to make the lifestyle choices for them and to be empowered to ask the right questions of their clinical providers.
Yes.
Absolutely.
Thank you.
Thank you.
Thank you again.
Thank you.